Hi, my name is Dr. Jack Stahl. I work at Town & Country Animal Hospital, and today I'm going to talk to you about a subject near and dear to my own heart, brachycephalic obstructive airway syndrome in all of our little smoosh-nosed dogs, and the surgery we can do to fix it and help our dogs live a happier, healthier life. Mwah. Brachycephalic upper airway syndrome is comprised of several anatomical abnormalities in the upper airway system. That means nose and the back of the throat. That leads to difficulty breathing. This can cause snoring, snorting, wheezing, vomiting, regurgitation, and other GI issues, exercise intolerance, overheating, and sometimes even death. If you own one of these breeds with short nose and you notice that they snore every night very loudly, or you're out on a walk with them and they can't catch their breath, they're panting all the time, you can hear that wheezing in the back of their throat, they seem to get overheated easily, they can't walk as far as you think they should walk, come on in for an appointment with your vet and we can evaluate what's going on. Maybe we can fix this. Brachycephalic obstructive airway syndrome is comprised typically of 4 components. The first is Stenotic nares, which are basically just narrowing of the nasal passages anatomically. The second is an elongated soft palate, so the palate is too long for their little mouth and it goes all the way down into the trachea and causes difficulty breathing. And the third and fourth are everted laryngeal saccules and tonsils. So the tonsils and the saccules, which live here, and the tonsils live here, they evert into the airway as well. And all of this makes it really hard for your puppy to breathe normally. So brachycephalic dogs have a really short nose, and that really short nose then leads to a really long, soft palate, goes down the back of their throat, and it basically is inside the trachea, which is your breathing tube. So if you have something fluttering around your trachea while you're trying to catch your breath, it's obstructing. It's causing less airflow to get into the lungs. And add the short and the small nose passage, they can't breathe in this way either. So you have a dog that's out, it's hot out, he's been running around, and we're trying to catch our breath, and he can't because he can't breathe through his nose, and then he can't breathe well through his mouth either because he's got this soft palate in the way. So they struggle more to breathe and they use more force to try to get the air in, and that causes inflammation in their throat and also in their lungs, but in their throat first. So inflammation makes it harder to breathe, and then they struggle more, and then ultimately their temperature really rises and they can actually get pulmonary edema and go into heart failure and die. Surgery is recommended for any of our brachycephalic dogs that can't breathe just as well as our golden retrievers or our chocolate labs. It is never normal to have a brachycephalic dog that can't exercise or gets overheated when it's hot out or snores and snorts constantly. As many of you may know, brachycephalic dogs have a mildly increased risk of anesthetic complications when we go under anesthesia. So when I recommend surgery for these dogs, I recommend that you do it along with the spay or neuter. So we're putting them under one time and we're taking care of everything at once under one plane of anesthesia. Every dog is different, but typically when I do this surgery, I take care of the stenotic nares, and what I do is I take out part of this fold right here that's pinched together, and there's also a big fold of tissue inside the nose called the alar fold, and that actually is causing most of the obstruction in the airway up here. So I take that out as well, and that's all on the inside. Don't place any stitches. That stops bleeding on its own, and they go home without any stitches. The other thing we do is I go down into the back of the palate and I make an incision just like this, way down in the back of the palate, and I take out as much as like 2 inches, sometimes less, sometimes more, depending on the dog, just to make sure that that palate is no longer down in the trachea, causing airway obstruction. The third and fourth thing I typically do is take out the tonsils and take out the everted laryngeal saccules. So we do all of it at once, and they wake up a totally different dog. They go home the same day. I don't like my brachycephalic breeds stressing out and staying here overnight. I think that causes more problems. We don't want inflammation in the back of our throat ever, but certainly not right after surgery. So they go home the same day. They go home with several medications to reduce inflammation, reduce anxiety, reduce vomiting, regurgitation, and sometimes a little sedative to help keep them calm and quiet. They also go home with a strict regimen of ice cream 3 times a day, also to help with the back of the throat, and soft food, of course, for about a week to 2 weeks, and they're typically fine after that. So immediately after surgery, literally the first night, you probably won't hear any snoring anymore. They breathe better immediately. Now, we want to keep them calm and quiet, of course. We don't want any swelling back there, but typically you'll notice a difference immediately, right away. The nose is going to swell up a little bit. The nose is going to have a little discharge for a few days. That's totally normal. And that's probably the thing that's going to take the longest to heal at like 1 to 2 weeks, meaning it'll still drip a little bit. We're not going to be able to breathe well out of it while it's all healing. But it will heal, and we will breathe beautifully through that nose. I did this procedure on my own dog during her spay, and the first night she didn't snore. The second day she wanted to go for a walk. I kept her calm and quiet for 2 weeks, and then we did go for a walk, and yesterday she went for a 3-mile walk, running around with my golden retriever. She had a great time, no airway issues, breathing beautifully, had plenty of energy afterwards too. She's a totally different, much happier dog. I've always loved doing surgery, and since having my own Frenchie and first Brachycephalic breed, I've come to understand firsthand the plight of these awesome little dogs who, through no fault of their own, simply cannot breathe normally, and it's limiting how they can live their lives. And since doing the surgery on my own dog, I've noticed a huge difference in her attitude, her energy, and her excitement at life. I want all of them to have the ability to breathe and to live like a normal dog should. Thank you so much for watching this video. So many of our patients and our own family pets suffer from this condition, and we can fix it. No dog should struggle to breathe.